Okay, we'll get started. Good afternoon, everyone. Welcome to Supporting Construction Workers, Suicide Prevention, Mental Health, and Substance Use Awareness, presented by CPWR, the Center for Construction Research and Training, and the National Asphalt Pavement Association. My name is Christopher Rodman, and I am the CPWR Opioid Projects Coordinator. The construction industry has one of the highest suicide and opioid overdose rates of any industry. In a given year, we can expect 4 times as many construction workers to die by suicide than due to a work-related injury. And construction workers are 7 times more likely to die of an opioid overdose than the average worker. Today, we will spotlight the impact that suicides, mental health disorders, and substance use have on the trades, and share resources and examples of what stakeholders can do to support workers and keep them safe in a dynamic environment. Our first speaker today is Dr. Jay Winford. Dr. Winford is the current National Asphalt Pavement Association Chairperson and president of a multi-generational family-owned business. He brings both technical and practical acumen to the road construction industry. At the age of 13, Jay started working around the family shop and then as a crew member on asphalt road construction jobs. Working in a multi-generational family-owned business provides Jay with a unique perspective to understand the concerns, needs, and well-being of his company's employees. He received his doctorate in civil engineering from Auburn University. Jay, I'll pass the floor to you. Welcome and thank you for being here.
Christopher, thank you for the wonderful introduction. If you can just give me a thumbs up for an audio check that you can hear me okay.
Very loud and clear. Perfect.
Good morning and good afternoon to all. I'm Jay Winford with Prairie Construction. We're located in South Louisiana. It is an honor and a treat, which you'll find out in a minute, for me to welcome and introduce our wonderful resources today with this wonderful event brought to you by the National Asphalt Pavement Association and the Center for Construction Research and Training. The reason this topic is near and dear to my heart began years ago. My first official NAPA duty as chairman was December 2019 to address the asphalt community, the asphalt contractors in Oregon. I was there prepared with my 45 minutes of remarks to talk about where the industry was and where we were headed. However, the resource before me was an ex-federal prosecutor that looked somewhat like Elliot Ness by the name of Dwight Holton. He retired from his job, and now he is the CEO of Lines for Life. That's linesforlife.org. That is a suicide prevention program. And during that passionate talk, Dwight told the group, and I was shocked to find out, that the highest rate of suicide of any industry in the United States is mine. One of the reasons this affects me so much is I lost a dad to suicide. I think that it's been a topic that has been somewhat taboo in our industry to talk about it. I think we need to train our coworkers and our employees and our managers. We all suffer from issues at certain times in our lives, and that's okay. We need to train, with the help of Marianne and Jamie, how to talk to them, how to recognize it, and how to deliver the care and the help that we need. I am happy to say that I work in the best industry in the United States of America. We literally built this country. So I'm very excited to hear from our 2 wonderful resources today, both of whom I'll tell you a little bit about. Marianne Wolfe has been the Managed Care Supervisor for the Allied Trades Assistant Program, ATAP, since April 2016. She has served clients and family in the behavioral health field for over 15 years. Marianne completed her bachelor's degree in Human Development and Family Studies from the Pennsylvania State University in 2002 and earned a master's of social work from Temple in 2011. And then she got her license in social work. Prior to starting at ATAP, Marianne provided direct clinical services and clinical care management for the Bucks County Drug and Alcohol Commission and to the Council of Southeastern Pennsylvania as manager of clinical and program services. We're happy to have Marianne with us today. We're also proud to have Jamie Becker with us. She is an at-large director of the Board of Trustees with the Construction Industry Alliance for Suicide Prevention and will be speaking with us in that capacity today. Jamie is also the director of the Health Promotion Division for the Labor's Health and Safety Fund of North America, located in Washington, D.C. Jamie oversees a variety of fund programs and initiatives. She specializes in behavioral health issues, including mental health, substance use disorders, and suicide awareness and prevention. Jamie sits on numerous health and safety related advisory committees. She is also a licensed clinical social worker. And with that, and with great humility, thank you, ladies, for sharing part of your day with us. And I'm anxious to hear you how you can help us help others.
Good afternoon. I would just like to thank everyone for attending. Mental health and substance use disorder is such an important topic to bring to the forefront. I hope after today there is an understanding of how important these topics are and how they should be considered as important as a member's physical health safety. Reasons for substance use in the construction industry. Long hours. The stress of working around the clock is directly correlated to using drugs and alcohol. Many construction jobs are routine and predictable. Individuals who work long hours on jobs like this are more open to developing substance use disorders. Unstable work. Many positions in the construction industry are project-based, followed by periods of unemployment. Drug and alcohol use can result as means to cope with the uncertainty. Physical distress. Ongoing strain on the body and physical injury can also result in substance use. And conversely, substance use can also lead to further injury. The nature of the work and the attitudes of many of the workers are similar to work hard, play hard. This philosophy is particular for this social group. In addition, many individuals working in the construction industry come from backgrounds where alcohol use and even illicit drug use are relatively accepted and common. Construction workers have the highest mortality rates for drug overdose deaths and prescription opioid-related overdose deaths, according to the Centers for Disease Control. Construction workers are 7 times more likely to die of an opioid overdose than workers in other industries. Construction workers have the highest proportion of heroin-related overdose deaths. Construction workers represent about 25% of fatal opioid overdoses among all workers. Manufactured fentanyl has become present in drug markets. Non-opioid users are dying as fentanyl is mixed with other drugs such as cocaine and methamphetamine. Data is trending to likely show that fatal overdoses have increased dramatically in many communities during the COVID-19 pandemic. Reasons for this increase includes increased depression and anxiety tied to the pandemic, the end of in-person face-to-face prevention and treatment services due to COVID-19 precautions, and unplanned stops and starts in drug usage and isolation. Individuals presenting with cocaine use and methamphetamine use are now testing positive for fentanyl when entering residential treatment. Medical criteria for cocaine and meth use disorder is for residential treatment. Due to the lacing with fentanyl, individuals are requiring a higher level of care and being placed in detox. According to data from the National Survey on Drug Use conducted by the Substance Abuse and Mental Health Administration, employees of the construction industry have nearly twice the rate of substance use as the national average. Around 15% of all construction workers in the United States have a substance use disorder, compared to 8.6% of the general population of adults. About 1.3% of the construction workers have an opioid use disorder, almost twice the national average. 16.5% of construction workers reported heavy alcohol consumption within the past month, nearly twice the average of all full-time workers. 14.3% of construction workers were diagnosed with a substance use disorder in the past year, more than 1.5 times the average of all full-time workers. I can speak on statistics for hours, but what does a member look like when seeking assistance and support for substance use disorder? The general assumption today is that an injury on the job site of an individual is the reason so many have become addicted to opiate pain medications. But is this truly what has led so many of our members to become addicted? When a member enters into treatment, ATAP receives a biopsychosocial assessment on each member, which is reviewed. These evaluations allow us to see the full picture of an individual's life stemming back to childhood. Although each member is noted as being a good person, good worker, these individuals have been lacking support stemming back to childhood. Although the conception of an individual is that he was a good worker, he got injured and became addicted, the situation is much deeper than that. For most, their addiction began as an adolescent. Traumas are often part of the individual's background. Family addiction, legal involvement, are all parts of our members' histories that we are negating by assuming it was the work-related injury that made them addicted. The general assumption of the injury is what often has brought the addiction to the forefront. They continue their addiction, and then we are attending funerals for these individuals. Construction work is hard on the body, with back and joint injuries that can result in chronic pain. When the need to keep working is added to the mix, employees have an incentive for coming to work while impaired by medication. Their impairment is not generally obvious, especially to the untrained eye, and they are allowed to take the controls of heavy machinery, drive vehicles, and perform other activities that require high levels of judgment and unimpaired reflexes. In the past, it is not unusual for a patient to receive 30 or more pills at a time, particularly if they were being treated for chronic pain. Once addicted, they obtain more drugs by doctor shopping, getting refills at multiple pharmacies, and buying them from friends or dealers. Often the expense eventually leads to heroin use. As part of our efforts, we are now gearing all education and training surrounding the fact that addiction and mental health issues begin way before the work-related injury. We are now gearing trainings around the whole history of a member, not just from the point of the accident. Statistically, our industry is one of the worst in terms of workers suffering with mental health issues and one of the highest rates of suicide per industry in the U.S. The construction industry is the perfect example of how differently society views physical and mental health. You might not think it, but one of the worst industries to be in when it comes to mental health is the construction industry. Despite all the stereotypes related to the construction workers, they are some of the least supported individuals. What is the perception? The perception is that the construction industry is male-dominated and the perception that men who work within it are tough. Recent surveys have suggested that 64% of construction workers want better support for their physical health, mental health, overall well-being, with calls coming from within the industry to have a better awareness of mental health. This is a very harmful perception to hold and makes it difficult for individuals who are struggling to ask for help or to talk about their feelings and mental health. But here's the thing, construction workers want that support structure. When evaluating members and clinically recommending higher levels of care, I often get the response that my employer cannot find out, I cannot miss that much work, etc. These are the members that are often hospitalized involuntarily because their signs and symptoms became so severe that family intervened to get them help. Could this have been a different outcome if the environment they work in was more supportive? This is a call to take action to not only eradicate the stigma of perceived construction workers, but also see what else can be done for their mental well-being. Suffering in silence. Many workers feel forced to deal with it, not seeking out the help they need, and symptoms get worse. To counteract this long-standing challenge, the mental health of your workforce needs to be prioritized at the same level as safety on the job. The Construction Industry Alliance for Suicide Prevention reports that many within the industry suffer in silence due to the cultural expectations. Despite advancements in education and awareness, mental health issues remain stigmatized in some circles, and suicide is a taboo topic on the job site. While some within the industry struggle to keep up with an evolving narrative about mental health, empowering workers to seek out resources is a crucial part of every manager's job description. The CDC has found that the construction industry exhibits many common risk factors that are associated with feelings of helplessness. These risk factors include, but are not limited to, competitive, high-pressure work environment, high prevalence of alcohol and substance use, end-of-season layoffs, separation from family, physical demands of construction work. All of the above and more are proven to challenge mental stability. Their effects on an individual's well-being are only compounded within a work culture that is viewed as tough. What you can do to help. One of the most powerful tools in your toolbox to fight against behavioral health issues is education. No progress can be made without a cultural change, and every educated worker is a step closer to decreasing the stigma that keeps workers from facing their inner demons. While regulations and monitoring for physical safety have increased dramatically over the years, behavioral health continues to lag behind. Mental health and substance use disorder are important and need to be prioritized as highly as wearing a hard hat. Working in construction is tough, there is no denying it. But is there a direct correlation between working in this industry and behavioral health issues? On a daily basis, we receive phone calls from business agents and members reporting that they need assistance. One example is a business agent that contacted our office noting that a member with a known drug and alcohol history is using again, and he wanted me to reach out to him. The individual was constantly late for work, often visibly tired, and has a difficult time focusing on the job. The business agent stated that the member was therefore let go from his position. I asked if there was a drug test that was given to confirm his substance use, and there was not one. When I called this member, I quickly realized that his relapse was an assumption. The member discussed with me that his mental health medications were just switched, and he was having a difficult time adjusting to the medications. He noted that in the past, he went and asked for help for his substance use disorder, and now he automatically felt that he was being labeled. He felt at this point he should have never came forward in the past to seek help. Oftentimes, mental health signs and symptoms can mimic those of someone under the influence. If his coworkers or business agent would have had a conversation rather than making assumptions, they could have helped him and supported him rather than removing him from the job site. So what steps can we take? Stigma. Untreated drug and alcohol use contributes to tens and thousands of deaths every year and impacts the lives of many more. Minimal progress has been made in removing this stigma surrounding substance use disorders. People with addiction internalize this stigma, feeling shame and refuse to seek treatment as a result. People continue to be blamed for their disease, even though medicine reached a consensus that addiction is a complex brain disorder with behavioral components. The public, healthcare professionals, and the criminal justice system continue to view it as a moral weakness and flawed character. Separating the illness from the person. He's living with bipolar disorder instead of saying he's bipolar. Be compassionate with the person and hard on the illness. It is not the person's fault that they are living with an illness. It's an illness. Often we want to dismiss the obvious cues that we are being given. But why is this? Why are we passive when there is present cues and calls for help? Why are we hard on the individual and not the illness? Why does it take a tragic event to call for change? My executive director and I met a man who had this experience. It took his son ending his life to suicide to realize that he needed to be more compassionate and aware of his employees who live with mental illness. He did not understand what his son was going through and did not understand what his employees were going through. He would tell his employees to get their acts together or get out. After his son's death, he realized that this was not the way to deal with anyone living with mental illness. And this is what we are calling for. We are calling for change. Change before something tragic happens to not only one of your employees, but also to one of your family members. So what is the solution? The most effective approach to addressing a public health crisis is the public health model. What is the public health model? The public health model addresses prevention and awareness, intervention, treatment, and support. ATAP has adopted the public health model in terms of all aspects of treatment of members, education of members, and support for members. Over the years, we have come to realize that it is not a one-size-fits-all for the members, along with the fact that not all members' addiction began at the time of a work-related accident. We have formulated all our programs to date to run along the public health model. In terms of prevention and awareness, we have incorporated trainings into our union's apprenticeship programs. They have provided an overview and understanding of the physical and psychological effects of substances. It allows for individuals to understand and identify the signs and symptoms of substance use, along with provide the individuals resources in their toolbox to provide access to not only community-based resources, but also their EAP. With intervention, it allows for development of an effective employee assistance program. Employee assistance programs are designed to assist in the identification and resolution of productivity problems associated with employees impaired by personal concerns that may adversely affect an employee's job performance. When a member contacts our office, they are provided a full evaluation to see what's going on. ATAP, from that evaluation, will make a clinical recommendation to treatment based on that information. When looking at the greater picture of a member through the evaluation completed at time of contact, along with the biopsychosocial completed, we've realized that we need to consider all aspects of a member's background. Physical health, safety, and behavioral health need to be taken into consideration and placed on equal playing fields. We cannot just consider a person's addiction to be when the latter collapses on a job site. An individual's safety needs to be taken into account at all levels prior to that accident, during treatment, and post-treatment. What safeguards are in place to allow for an individual to safely seek treatment and return to a supportive environment? Again, through the biopsychosocial assessment, we realized that the support on the back end when a member reintegrates back into the workforce was missing. Our peer advocate program was developed to allow for support all through the process of the public health model up to and including reintegration back into the workforce. SAMHSA has defined recovery as the process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. Recovery is a personal journey with the goals of hope, empowerment, and autonomy. I would just like to thank everybody for being available and attending today, and I would like to hand it off to Jamie.
Great. Thank you so much, Marianne. Such great information, and admittedly, there is going to be a little bit of overlap between what Marianne discussed and what I'm going to discuss, because it's near impossible not to kind of reset the table on that one. So just want to thank CPWR so much for inviting the Construction Industry Alliance for Suicide Prevention to be a part of this important and meaningful discussion. Moving forward with the rest of the presentation, given that the organization is kind of a mouthful, I'm going to refer to it as CIASP during our conversation today. And just a little bit of background, and on my last slide, I will have a web address for the CIASP, but it was born out of necessity, as Marianne mentioned and Chris mentioned. The statistics around suicide in relation to construction are just mind-blowing. And the first time these stats came out was in 2016. They were put out by the CDC, and they covered the time period of 2012 to 2015. And while we might have known that there were issues related to mental health within the construction industry, that study for sure solidified that and really and truly blew the lid off of a problem that we for sure, and a very important issue that we for sure have to address. So CIASP was started in 2016. It was formed by the Construction Financial Management Association, and then it formally became a 501c3 in 2018. We realized that this issue was not going away. Numbers around suicide, right now they're kind of staying around the 48,000 person per year mark in terms of death by suicide. However, especially after this year with the pandemic, we know that a greater number of folks are dealing with mental health challenges. And just as Marianne explained with substance use issues, they often don't occur at the point of a workplace injury or accident. Suicide is generally not something that someone thinks about or considers overnight. There's usually a lot that's gone on that gets someone to the point where they're in so much pain that suicide becomes a reasonable option to end that pain. Just want to let you know that CIASP is dedicated to try and change these statistics by educating and equipping organizations, industry service providers, and construction professionals. We for sure recognize, and construction is a particularly complicated industry, and I think that's part of what makes this such a challenging issue to address. We've got unions, we've got employers, we've got associations, and within each of those, there are a lot of different layers and a lot of different cooks in the kitchen, if you will. And if we can at least get everyone on the same page and acknowledge that these are really important issues and that they need to be addressed, that's going to be a really good first step. And that's one of CIASP's main goals and mission. My talk today, admittedly, is only going to touch the surface, as I'm sure Marianne can, and probably many of you on the call as well. I could talk about this all day. I could probably talk about it all week. But I am just going, for the purpose of time and the interest of time, cover some basic statistics. I'm going to just very quickly go over reasons why suicide is so prevalent in the construction industry. Marianne, you already did a great job of that. I'll just try and focus on information that you might not have already discussed. And then I'm going to review a number of resources that CIASP has either developed, made available, other folks have shared with us. And these resources are going to allow for a richer and a deeper dive within this subject. I know a question is often, where do we start? What do we do? How do I have a conversation? And I'll just say to folks on the call, just like if someone gets injured at work physically, we certainly don't expect those responding to be doctors or nurses. Same thing when it comes to mental health, substance use disorders, and other emotional issues that people deal with. We are not expecting anyone to be a mental health expert, a therapist, or a counselor, but rather to try equip you with the tools to help facilitate getting somebody to the appropriate help and care that they need. Perfect. All right, so a bar chart is worth 1,000 words, and I would argue more than 1,000. So just to give you an idea of how deaths by suicide in the construction industry compare with construction-related fatalities, I've developed this chart. I'm not very techie, and as I was putting this chart together, I was overwhelmed and blown away by how poignant and how powerful the chart is. So you'll notice that blue represents construction workers, and red represents everybody else. So in terms of work-related fatalities, the most recent numbers, 2019, there were 5,300 fatal occupational injuries in 2019. Almost 20%, a little bit more than 1,000 of these were in the construction industry. So you can see the bar chart on the left is showing construction-related fatalities relevant to other occupations with fatalities. And then if you look over at suicide, and if you look over at suicide, you can see the construction numbers are in blue. And just to let you know, that number is 49.4. All of these numbers, I'm sorry, I didn't say this before, are out of 100,000 lives. So for construction, the number of fatalities is close to 10 workers per 100,000 lives in terms of occupational fatalities. And then for suicide-related deaths, the number is close to 50 per 100,000 for suicide. So, you know, just sit with that for a minute. And I don't want to have a comparison about which requires more time or attention or which is more important to focus on. They're both important to focus on. And we know that we have come a long way with safety that we can easily see, cite, and enforce. And now it's time for us to catch up in areas of safety not previously considered or understood. And that's for sure something that you'll notice is a common theme between my talking points and Marianne's talking points, that emotional health really is a part of health and safety just as much as physical health is. Our heads are connected to our body, and we need to address the entire person, not just from our necks down. So our third slide, and Marianne went over a number of these, but just looking at why suicide rates are so high in construction. It is a male-dominated industry. And one thing I do want to point out, many of the same things that are so great about this industry and that make the workforce so amazing, hard work, get it done at all costs, dedication, no excuses, and a tough it out mentality, are also the same things that can become the greatest weaknesses when they stop someone from asking for help or cause someone to be bullied, harassed, or disciplined for behaviors that are actually crying out for help. So admittedly, it's not about changing the industry and making it soft or weak. It's about creating awareness and building in protective factors around the identified risks. We don't stop building tall buildings or digging deep trenches because it's dangerous. We create protective systems to keep people safe while working on them. Suicide prevention is no different. And these slides will be, my slides will be shared afterwards, so you can go ahead and look through in more detail some of the additional factors as to why suicide rates are so high in the construction industry. So just real quick, chronic pain from hard physical labor, higher rates of drug and alcohol abuse, as Marianne mentioned. We are finding that shift work, non-traditional hours are causing major disruptions with sleep, and sleep is a huge contributing factor to depression. Financial stress is huge, no work, no pay, lack of paid leave, time away from families and taking away a lot of those built-in support systems. As I mentioned at the beginning of my talk, it's a really complicated industry. It's a very multifaceted industry. And in a lot of environments, and a lot of times, folks aren't necessarily working for just one employer throughout the course of the year. And that definitely can add to part of what makes this such a difficult topic to address. So something that I don't really like to say, but it's like the most effective way that I've been able to come up with to be able to address this. So how do we reconcile business needs with human needs? We know that work needs to continue. We know that folks are not operating their businesses and doing their work that they're doing because they're a volunteer organization. We also know that people are at the heart of the work being done. So how are we reconciling the business, the aspects of the business that could be contributing to some of the mental health factors that make the rates of drug abuse and mental health issues higher in construction? And a question is often, where do we start? What do we do? And Marianne discussed a lot of these, especially around stigma, around the public health model. One other thing that I want to mention, and I propose to each of you, is a culture change. And so you might be wondering, why is there a set of baseball gloves in the middle of the screen? And so while it is baseball season and it is feeling a little bit more normal this year than last year, believe it or not, when baseball first started to be played, players didn't wear gloves. it was considered a sign of weakness. In fact, those who did start to wear gloves or make their own gloves made them in a skin tone color so that the fans couldn't see that they were wearing a glove for fear that they would be considered weak or less manly. And certainly we could argue baseball, as well as many other sports, has come a long way in its viewpoint around equipment and safety. And this definitely has required a change in perspective, which also results in a culture change. And I argue the same can be said around construction as well. Nowadays we couldn't imagine Mike Trout or Mookie Betts not using a baseball glove. There are a lot of other aspects around safety on a job site that I imagine 50 years ago we never could believe are in place today, and yet they are. If you go back and look at old pictures, just even what people were wearing, the lack of PPE on a construction site versus how things are today, there's really been a huge shift around safety in that regard, and I argue that mental health needs to be part of that culture shift and change as well. Workplaces can play an essential part in maintaining our positive mental health. They can give people the opportunity to be productive, to be part of a team, and contribute to their community, especially in construction. It's look around your communities. Construction workers are building everything. But at the same time, we know that these workplaces can also be stressful environments that contribute to the rise in mental health problems and illnesses that we're seeing today. No workplace is immune from the risks, and none of us can afford to ignore them. So Marianne covered this in some detail, why men are at greater risk for some of the substance use disorder issues that we're seeing. They're at potential extreme extra risk, if you will, for death by suicide. Just a couple things that I want to point out is that depression often goes undiagnosed in men because it very often manifests itself differently than it does in women. In men, depression often appears more as anger and irritability. Typically, and I recognize I'm making sweeping gender assumptions here, but they bear out in the clinical environment. Men also tend to describe their own feelings as stress rather than sadness or hopelessness. So that's a really big issue in terms of being able to diagnose someone when they are at a doctor. Another thing is that men often try to self-treat their symptoms of depression or anxiety, especially with alcohol and other substances. We've also seen very often that men tend to go inward, whereas women might seek out support from family and friends. Men tend to turn to other outlets such as video games, sports, and self-isolation. Very often also construction, men are turning to drugs and alcohol, not just to deal with the emotional issues, but to also deal with the physical pain that is very real for folks after having done a physically base type of job over a period of time. The other reason why men are at greater risk of suicide, and I'm going to discuss this in a couple of slides, is that more often men tend to use firearms with suicide, and the rates of completion for death by suicide when a firearm is used are significantly higher than when a different method is used. Marianne talked about mental health quite a bit, just to try to bring it to life for you. So it was mentioned, I do also work for the Laborers Health and Safety Fund of North America, in addition to being a board member for CIASP. And this is from one of our job sites out in California. There are 10 people in this picture. Half the people in this picture are going to experience a mental health issue at some point in their life. 2 of the people in that picture are currently struggling with a mental health issue. We're also starting to get data from the past year, and studies are showing that there's been a significant increase in the number of people in the United States over the last year who are taking some kind of medication to deal with a mental health issue, especially depression and anxiety. Nationwide, 18 states are showing a 10 to 20% increase in the number of people being prescribed a medication. One other thing that's also really important about mental health and why I believe it's especially important to address it in this industry and address it as soon as we can. Unlike a lot of other chronic health conditions that don't show up until we're older, like in our 40s, 50s, or 60s, mental health issues tend to present a lot earlier. And in adults, they do tend to present more often. With folks who are in their 20s or 30s, that means that a worker on a job site could potentially be struggling with this issue, especially if it's not identified and treated throughout their entire working career. And I think that by itself is a really compelling piece of information. So one other thing I did want to focus on, this slide that talks about guns. And I want to be really clear, I'm not having a discussion about the Second Amendment and whether people should or should not own firearms. That's not my job. It doesn't matter what I think. But we do know, as a matter of fact, that there are a lot of people in the construction industry who do own firearms, whether they're using them for sport, for hunting. We know a large percentage of the population might be veterans. People have firearms to protect themselves, their home, their family. And we know that they're culturally acceptable, and pretty normal in everyday life in a lot of the country. And that's okay. The reason why I bring this to your attention and just want to highlight this, you can see from this chart that of all suicide attempts, guns are used in 6% of the attempts. Yet the level of completion, if you will, or actual death by suicide with a gun is a 54% success rate. I don't like to use the word success. I'm kind of struggling with another word to use, but hopefully that makes the point. Suffocation or hanging is the second most common way that people die by suicide, and poisoning is the third. So as you can see, with a less passive way of attempting to die by suicide, there's a lot more opportunity for someone to have time to come in and intervene with that. The other aspect about suicide that it's important to understand, like I said, it doesn't necessarily occur overnight that someone is feeling so badly or in so much pain. However, the moment at which someone decides to take their life, it's our understanding from survivors, is that it's often impulsive. They might be under the influence of drugs or alcohol. They might have just had a really heated argument with someone they care about. And when access to a gun is very easy in that moment of impulsivity, if they have access to the firearm, the likelihood of completion is going to be a lot greater. I put this out there to say, if you're aware of someone's safety, if you're concerned that someone could be a risk to themselves, I'm not saying they should never have a gun, but if the gun can be removed from them temporarily, that's definitely going to be a strong recommendation at this point. So most of my remarks, I recognize we're getting close to when we need to be focusing on some Q&A. I mentioned to you there are a number of resources available through the CIASP. Marianne and I have both talked about a lot of really serious issues, a lot of information that might be overwhelming a lot of people. So you might be thinking, where do we start? What does this look like? So when you get these slides, or if you want to copy down this web address, you can go to the CIASP website. They've compiled a multitude of tools and resources to help integrate suicide prevention, whether you're a company, an association, or a union, as a health and safety priority. The materials can be used on a local level. For example, I'm more familiar with the union structure. So for an individual local union, for an individual training center, they can also be used on a more macro level nationwide if a construction trades union wanted to adopt some of these programs and look at them. The most important thing about this slide is that we're trying to connect people with the resources so that you can learn how to safely ask the right questions and get the right help. On this website, there's a needs analysis and an integration checklist, which walks folks through a series of questions to help evaluate your company's suicide preparedness Like everything else, there are probably some folks on this call who are early adapters and are ahead of the game. And then there are other folks who might be thinking, this is really important. I know I need to do something about this. I'm just not sure where to start. There's also a 3-level document on the website that provides clear and simple steps to help your company address suicide prevention. There are toolbox talks, there are posters, there are screening tools, there are wallet cards that list different signs and symptoms that people can look for and should look for, as well as some resources to call and get some help. There's an option to download all of this. There's also an option to purchase some of these items. Again, CIASP is a non-for-profit, but some people might not have the resources or the time to figure out how to download their own wallet cards for free. So you are able to buy them. The last thing that I want to mention on the right-hand side of the screen, CIASP has put together a pledge that we are encouraging all organizations, again, no matter how big or small you are, to stand up for suicide prevention. And the pledge is called STAND, S-T-A-N-D, and as you can see, it stands for, the S is for safe, the T is for training, the N is for normalize, and the D is for decrease. This can be done by creating safe cultures, providing training to identify and help those at risk, raise awareness about the suicide crisis in construction, normalize the conversations around suicide, and decrease the risks associated with suicide in construction. Lastly, I just want to provide some national resources. There's a crisis text line. There's a suicide prevention lifeline. There's a specific part of this lifeline where when you call up, I can't remember, it'll say 1, press, I think it's 1 if you're a veteran, or it might be 2 if you're a veteran. The other 2 things that I do want to say is that please do not worry if you have a conversation with someone and mention the word suicide, that you are going to put that idea in their head. Someone is not going to think about suicide or take the steps to die by suicide if they were not already contemplating and considering this on their own. You're not going to make someone think about this, get this idea, and suddenly act on it. The other thing is often folks don't know where to start. Obviously, we don't have enough time to necessarily walk through what that looks like. But I will say there are 3 words and then there are 4 words that can really go an incredibly long way. And they are, how are you? Or how are you really? I find when I ask, how are you? And if I just get kind of blown off or told, fine, whatever, and you get the sense that there's more there than how are you? How are you really? Lets people know that it's more than just a run-of-the-mill, you don't really give a crap about their answer, but that you really and truly are interested in what they have to say. So thank you so much for your time and attention and for taking all of the different issues that we addressed here today so seriously and considering how to put them in your health and safety plans.
Thank you, Jamie. That was fantastic. Appreciate you taking the time today. I've got a few questions that we can start right off the bat. I think this one might be flagged for Jamie. Since the impact of mental well-being, substance use, and suicide prevention is an issue for the entire construction industry, shouldn't a uniform industry-wide program for education and training be developed?
Thanks. And that's a great question. There are a couple of initiatives within the construction industry that are going on for exactly this reason. I believe I mentioned NAB2 a couple of different times. The National Association for Building Trades Union does have an opioid task force, and through our work with the opioid task force, it's almost impossible to talk about substance use disorders and any kind of drug-related issues without also talking about mental health and suicide. So on that task force, which is made up of a number of different international unions, employer groups, and associations, contractor groups, we are addressing those very issues. I also just want to point out that through NAB2, there was a resolution that was passed at the convention last year that also talks about mental health and suicide prevention. So those are two issues that I'm aware of. And I can also just say that on behalf of CIASP, to the degree that we can try and leverage industry efforts and try and all be messaging the same information and not recreating the wheel, we are definitely trying to do that. Thank you.
Great, thank you. Another question here. What are the practical ways we can help our industry's essential workers feel valued, appreciated, supported, and flourish mentally in this stressful post-COVID world?
Marianne, do you want to take that, or I'm happy? We can take it together. Why don't you go first?
Yeah, I mean, each individual is different. And, what we're seeing come across in our office is that, everything that's happened over the past year has affected not only our members, their spouses, but it's truly affecting their children. If the need for any type of treatment is to, be needed, seek out those resources and really get them to be able to provide for employees, their families, everyone that's involved, because the past year has, caused unprecedented increases in both mental health and substance use disorder. And, we just, continue to offer that support and provide resources to all our members.
And I guess just a couple of other things. I love that the question is even being asked, because the fact that there's acknowledgement that this has been a tough year for people is major. And just to even put out there to all of your employees that that it's been tough, and acknowledge all of their additional hard work, everything else that everyone's dealing with at home during all of this extra stress, while also trying to keep their jobs and keep their heads above water financially, is huge. So whatever way you're communicating with your employees, in person is always best. Emails go a long way, handwritten letters. If it's an email put out by the CEO, I don't know the size of your company or your organization, give some kind of acknowledgement monetarily is always appreciated. Another really thing in the construction industry is a lack of paid time off. I don't know if that would at all ever be a possibility, recognizing that time is money. But some time off would be great. Most important, acknowledge and recognize it. Do it often, do it frequently. And like Marianne said, continue to reinforce all of the resources that are available and that exist for folks to go and get any additional support that they might need outside of the workplace for themselves and their families.
Great, thank you. Here's a question about some of the antecedents to dying by suicide, and I think it could be extended to other areas. But is overtime something that can contribute to spikes in suicide rates? Workers working too much.
Well, I think that was addressed with both Jamie and my information that, just the work hours, the inconsistency of work, it may not definitely contribute to a member following through with suicide, but it contributes to one's mental health and substance abuse that all go together. So I think, yes. In terms of different mental health and substance use. In terms of suicide, everything at one point could be a contributing factor with an individual who's having those thoughts.
Sure. And we know that having a precarious work can lead to, mental health stress. So that makes sense.
Yeah, Chris, may I just add one thing, please? Thank you. Recognizing that the financial uncertainty is built into the industry, it sort of lends itself to folks taking on more work when that's available. One thing that we're really starting to focus on at the laborers is financial wellness, recognizing the inconsistency in potential pay and work to try to cut down on some of that stress so that someone might not feel the need to have to take on all of the extra work when it's there.
Perfect. Thank you. And I think there's a comment here that I think goes well with where we're speaking right now. To reconcile business needs with human needs, it would require a societal culture change where business primarily functions to meet human needs. What do you have any comments based on that idea? And how the business can reconcile?
I mean, I have to admit, I'm really, really struggling with what that looks like. And I think industries where there are different variables within the industry that at some point may or may not be able to be changed. And especially if we try to figure out what some of that low-hanging fruit is. I know paid time off is something that comes up quite often. One of the unions, I'm not sure I can remember which one, and I'm sorry I don't, but they recently put in a maternity policy. And some time off for women working while pregnant, understandably very stressful, and a lot of women were working up until almost their due date and not always having good outcomes. So I believe there are ways that we can get kind of creative, and once you think about them, it's like, oh wow, that was so obvious. But admittedly, it's on its face, it's a huge struggle and can be overwhelming.
Okay, great, thank you. I think this question might be an opportunity to highlight some of the resources. But if you have an employee, someone you know that has become stressed, you can tell that they have may have had some changes in their personality. It looks to you like they might be engaging in some harmful behaviors. And when you do try to speak with them, of course, they're insisting that they're doing fine. How do you engage with someone like that? And are there any resources that you could highlight for people?
With that, there are so many different clinical factors that go into an individual who is showing self-harm. They might be talking about helplessness and hopelessness. And we really drive home that, always refer back to the Employee Assistance Program, because we don't want anybody saying something that could trigger something. You don't know what's going on with that individual. Always refer back to the EAP. And we always tell our unions, we're here for a reason. We're here to support all members. Let us do that evaluation to see what's really going on, because it could just be, it could be more deeper than one anticipates. And we want to be able to provide the right level of care, the right resources, and direct the individual on where they need to go.
Fantastic. Thank you. Jamie, do you have anything to add? We're just up against the end here.
Just real quick, I would say everything that we're talking about here today, obviously, is so incredibly important. I would just encourage, though, that we not necessarily jump to conclusions. I think it's really important to show care and concern. I love Marianne's suggestion about referring folks to the EAP, but to not necessarily jump to a conclusion that someone is on the verge of something that they might not be, but to express caring, whatever you're seeing and if you feel like you should be concerned for the person, you probably should. It may or may not be for the reason that you think. So I guess I would just say, don't make assumptions, have conversations, be willing to listen, and make sure you have your resources handy and nearby before you engage in that conversation, so that if they do need help, you can easily give it to them or provide them with the number and make the call with them.
Great. Okay. Thank you. Well, we have arrived at 2 p.m. Eastern, so thank you all for being here. I encourage everyone to look at the links that have been shared in the chat, and that you should all anticipate receiving an email from us when this is available online. Jamie and Marianne, thank you so much for your time. Jay, thank you as well. This has been very successful, and I'm so happy that we are getting the word out. I think all of this helps reduce stigma, which is, of course, as we know, one of the main things that we need to do to get this conversation going and to help people. So thank you so much, and
Absolutely. Thank you.
everyone have a great afternoon. Thank you.
Thank you, Christopher.
Thank you.
Marianne. Thank you, Jamie. Wonderful.
Thank you.
Our pleasure. Thank you, everyone. Take care.